She typically gets the numbness, gets worse at night. That's usually an indicator that it is coming from the carpal tunnel region. Okay, so we have Haruko here from Japan, all the way here in New York City, and you live here though now, yeah? So she didn't come here all the way from Japan to see me, folks. Either way, what we're going to do today is we're going to show you how we treat carpal tunnel syndrome and radiculitis or paresthesia, numbness, tingling in the arms, hands, fingers. When you have tingling in the arms, the hands, the fingers, the forearms, or pins and needles or numbness, some people unfortunately get pain shooting down the arm. It's coming from a pinched nerve in most cases. There are some other things that can cause it, like medications, side effects of medications, and a couple other things. But typically, it's coming from either the neck or it could be coming from the carpal tunnel region right here. Now, she works at a desk in front of a computer. And you're not a hairstylist, correct? No. So hairstylists commonly get carpal tunnel syndrome and also have a lot of neck issues and complaints. So what we're doing is she doesn't have insurance, so we can't run expensive tests like an MRI of the neck or an EMG test, which is normally what we would do to see if she has carpal tunnel syndrome or if the nerves are being pinched or compressed at the level of the neck where maybe one of the discs are injured. And as you see on this poster over here, if you have a disc injury at one of those areas of your neck, it can create numbness, tingling, or different sensation into the arms, hands, or fingers. And you'll see numbers on the arms here. See 3, 4, 5, 6, 7, and those are the different dermatomes that the nerves control. So what we're doing with her is we're addressing it as if it could be coming from the neck or the carpal tunnel region. It only takes me an extra few minutes to laser her carpal tunnel region, and we're on what, our second or third?
I think third, or maybe fourth even.
Okay, how are you doing so far?
I'm doing alright. I'm not sure if it's getting better, but it's not getting worse.
Okay. Yeah, and we're early in the treatment here, but in a couple more treatments you should notice a big significant difference. Now, she typically gets the numbness, gets worse at night. So we're just gonna hold it right there, and don't look at the light. I'm gonna get you some glasses. She gets it worse at night, and that's usually an indicator that it is coming from the carpal tunnel region. If it's during the day, throughout the day, typically doesn't mean it's not carpal tunnel syndrome, but it's typically coming from the neck, especially if she has neck pain or tingling up here, which she does. Correct? Do you get any tingling or numbness in the upper arm occasionally?
Not much, but not
okay.
much.
Now, it's important to understand that she started, before we did laser, we started on chiropractic care with her in the cervical region. The numbness did get a little better, and then it came back recently. So we could also be dealing with both. We could be dealing with a pinched nerve in the neck and in the carpal tunnel region. But for me to run all these expensive tests doesn't make sense. It's expensive. Yes, it would zero in on our approach. I could either laser her neck or her carpal tunnel region, but we're just going to do both. There is no downside to doing this and lasering both carpal tunnel regions and the cervical spine. There's no side effects to this, no detrimental effects from cold laser therapy. Right now, cold laser therapy is the only FDA, the only treatment or condition, excuse me, laser is FDA approved for in America. So they don't, the FDA has not approved it for treatment of other soft tissue injuries. They're a little bit slow to do that because there's no interest to do that. Insurance companies would then have to cover it. So, and insurances are now just starting to cover cold laser therapy. So, and I'm gonna go in from the side. So we're gonna hit every angle of her wrist on both sides. Is one side worse than the other?
I think it's about the same.
Okay. And how's your setup at work?
Well, just a small desk and
Okay. Did you take one of my ergonomic cards?
yeah, I did,
okay.
and yeah, I tried to like set the angle right, and
Were you successful, or
I think so.
you
Yeah.
think so?
Yeah.
You want somebody to take a picture of you maybe
Yeah.
while you're at your desk,
Yeah,
you know?
I did.
Make sure your elbow's at a right angle, that not open too wide, not bent too much, and that your wrist and forearm are flat like this. But your elbow needs to be in at your side too. When it's out like this on the mouse or up like this, it's no good. When your elbow is
Okay.
away from your side, even 10 degrees, that contracts the supraspinatus muscle. And that's going to cause a lot of tightness across your shoulders. So that's something really important, the alignment of where your keyboard is. If you need to raise your chair and the keyboard's on top of the desk, you may need to get a footstool underneath
Yeah, I
your
have to get that.
Okay. You can even make one or get a milk crate, and maybe, I don't know if
Yeah,
that's going to be
either
too
way,
high,
that's
but you could probably get a makeshift one, you know.
Yeah.
So we do about this is a 50-watt laser. This is the new MR5 Active Pro with laser stim. But this particular one, I have it on a 50-watt, I can change it. So it's about 60 seconds per spot here that we're treating all 4 angles. When the numbness gets better, you'll see that I'll do maybe 2 spots, less areas. More laser penetration is not necessarily better, okay? You don't want to overstimulate the area. And actually what I'm doing with this laser right now is inhibiting the nerves. So we're using a frequency that inhibits, okay? And then after about a week, then we start changing the frequency to healing and repairing the soft tissue in the area and reducing the inflammation at a deeper level, okay? And then after we do her wrists, we're then going to come up and we're going to do 2 more spots in the arm and then up near the neck. So I'm going to have you slide your sleeves up a little bit up to here, okay? Again, we want to make sure we get all 4 angles here. Most important is the front of the wrist and the back of the wrist, though. Right where the carpal tunnel region is, where the bundle of nerves come right through, right here. Yep, right through here. Okay, I'm gonna pull that sleeve up. Okay. And then we're going to pull the other sleeve up afterwards and do a minute there. And you relax your arm. Okay. So some of the nerves pass through here in the arm. So again, I'm inhibiting these nerves. Do another 30 seconds there. We're going to do the other arm. And have you had any tingling in your legs or your feet?
Usually on my left foot, like around like middle or maybe second to the last finger.
Okay, so what we've been doing, I'm going to explain to everybody out there what we've been doing for you there is traction and flexion distraction technique, which we're not going to do today. We're just doing laser today. But I'll show you the points on her lower back that we do along the sciatic nerve. So there's a couple of points there that we're going to treat as well. And okay, now let's go ahead and have you pull up that sleeve right there. Good. Okay. Now we're going to hold that there. Good. So we're going to go here along the nerve roots. These nerves right here at the base of the neck travel down the arm and control the sensation in the arm. So I have a couple of lasers here. We're going to go ahead and get started on her neck while she's finishing up the upper limbs. This laser right here I have on her neck is a 25-watt laser. So we're going to leave it on there a little bit longer. It's not quite as powerful as this laser right here. And when I say a little longer, I just mean maybe 30 seconds more. That's it. We're not trying to oversaturate the area. We also have rental lasers, so we have lasers that you can take home and rent for the day, for a couple days or a week or two. And that's really helpful for people that don't want to go back and forth, or maybe they live farther away and they want to speed up their healing time, because these lasers really, in a sense, help speed up healing time 40 to 50% faster. Okay, we're going to stop there. Relax your arm there. Yep. You can put this hand down.
One last thing. Tell me what you think in comments below. I went to film school before I got my doctorate. I do all the writing, directing, producing, sound, editing, and the cool special effects you see here. Folks, I'm not asking for an Academy Award or an Oscar. Just a simple thumbs up if you like my video. And don't forget to subscribe to my channel for the latest, greatest content on YouTube. Thank you. Appreciate all of you.
So right now I'm over C6, C7, C5, C6. Nerve root, we're going to go slightly down to C7, T1. Right here. And then we're going to do the other side. Thank you. I'm going to come over here. You can look straight ahead for me. Yep. And folks, you don't feel anything at all, do you?
I don't hear anything.
Yep. But you will feel the difference afterwards. And I've demonstrated this laser before for people with trigger points along the top of the shoulders. We've shown, like, somebody with a 1 to 5 of really, really sensitive tender spots at a 5, and then right after we laser at 30 seconds, 60 seconds later, it's all the way down to a 2. So that's pretty incredible. Okay, and like I said, this one on the left is a little more powerful. So we're going to move this one a little bit more frequently. And now we're going to go to C7, T1, both on the left and the right side. We're almost done here, and then I'm going to show you what we do for the lower back for anybody that suffers from paresthesia, numbness, or tingling in the legs or the feet. Now, obviously, diabetes can cause that, so you want to make sure if you have, tingling or numbness in the toes or the feet, that you get checked. That's easy enough to do. Get some blood work done and just rule out diabetes. Obviously, if you have frequent urination, things like that, symptoms from diabetes, you definitely want to get that checked out before you go and start getting treated like this for numbness in the toes it's not related to a pinched nerve. Okay. All right. And we're all set there. Now I'm gonna have you lay on your stomach here.
Take off my...
Yes. Okay, so she said her left side is gets a little numb. And like I said, we're not adjusting her today. Normally we would put her on traction and flexion distraction, cox flexion distraction, but today it's a Saturday and she's got a busy day. So she's got some things to take care of. So we're gonna go over L4, L5, nerve root again, and I'm inhibiting the nerve. Same frequency I used on her neck and her carpal tunnel region and along her arm. And with this one, we're gonna do about a minute in each spot. Same thing. If we were using a 25 watt laser, I probably would do about a minute and a half. And if I was using a 15 watt laser, I would do it about 2 to 3 minutes in each spot to give you an idea. Now, a lot of people have lasers at home. I'm not sure what you're using because LEDs and lasers are different things. So I've done a video on that, the difference between LEDs and lasers. Be sure to watch that. And a minute is up. We're going to slide it right over L5S1. So most likely we're dealing with a disc injury. Again, she doesn't have insurance, so we can't run some of these expensive tests. But from 20 years of experience, I can tell you that's what's going on. Most likely a degenerative disc at L5S1, creating that numbness and tingling down the arm. In her arms, she's got both. She's got a pinched nerve of the neck, but also in the carpal tunnel region. Again, that's why I'm treating both areas. So we're gonna leave this here for about a minute. And then you'll notice the next spot I'm gonna go is right where the piriformis muscle is, right where the butt muscle is. And the sciatic nerve passes through there. So we're gonna go over that spot. And then we're gonna do one last spot at the bottom where the butt meets the hamstring. And you can even go further down to the middle of the hamstring, the back of the knee, the middle of the calf muscle right in the center. For really severe cases, hers is really mild. Her leg numbness, is that correct?
Yeah, it's not really bothering me like that much.
When does it get worse, the numbness in the toes?
When I move around and stop.
When you move and stop?
Yeah.
Okay. What about when you're sleeping or when you're sitting?
No, it doesn't really bother when I was sleeping or sitting.
Okay.
Yeah.
Okay. So there are some other reasons why people can get numbness while moving. There's intermittent claudication. There are some other things that need to be ruled out. As I said, numbness and tingling into the arms and limbs is not just a pinched nerve, not just carpal tunnel syndrome. There are a lot of other things it could be, a lot. So all of those things through an examination need to be ruled out. Everything from MS to intermittent claudication to diabetes. So there's just so many to go into. But nevertheless, if you're having numbness or tingling into the legs or the arms, you should go see a chiropractor and or a neurologist and or your internist and get the right referral and get that addressed properly depending on what's causing it. So now we're going to move on here to the piriformis muscle. Okay, and still you don't feel anything, right?
I don't feel anything, it's fine, yeah.
And that's pretty much it. That's an introduction to laser and how it can help people with pinched nerves, numbness, tingling. I hope that helps you guys. If you guys have any questions, feel free to comment below. I hope you like the video. I hope you subscribe. And thanks for tuning in.